If you're suffering with a bulging disc, here's exactly what you need to know about how to deal with the pain now, how to prevent it coming back again, and which exercises are right for it in the acute stage and which ones are right for it in the preventative stage. If this is your first time here, my name's Luke and I'm the lead practitioner at Body Zest Banstead. We're an osteopathic chiropractic clinic in Surrey, UK. We help a lot of people with bad backs, and a lot of people with bad backs have got disc problems. So in case you don't know, these are two vertebrae, and between the vertebrae, a disc sits between them. It's a shock absorber. It's got a fluid-filled sac in between it. And if we unfortunately put pressure on it in the wrong way and load it in the wrong way at the wrong time, what can happen is we can get a bulge that comes out. And that is essentially just that fluid-filled sac protruding, potentially hitting a nerve and giving us all those really unfortunate symptoms. It's more commonly associated with younger people because as you get older, that fluid actually goes away. That's more of an under 40s problem. And the most common thing that I've seen is people actually leaning into the boot of the car so that they're bent forward, slightly twisted, and they're trying to lift something all at the same time, and bang, that's when that disc goes. You've got to look at it in a couple of different phases. So when it originally happens, especially if you get the nerve being hit by that protruding disc as well, then we're going to get just really nasty pain down the leg, pain locally in the lower back as well. It's going to become inflamed. Probably not visibly, you're not going to actually see the swelling, but in there is definitely going to be inflammation and irritation of that nerve. So local back pain and shooting pain down the back of the leg normally can be, a different nerve that it hits, but usually this is the L5S1 which goes, and that's going to be numbness, pain, and potentially even some weakness in the foot. Now, management-wise for a problem like this, we're going to help people reduce the nerve pain. So we use things like Stimpod, which is essentially a neuromodulator so that we can actually just reduce nerve pain. And a lot of people are going to go on anti-inflammatories to try and reduce the local inflammation around the disc. And there is a little bit of time that's just going to be associated with allowing that acute phase to end and just making sure that you don't actually cause any damage during that time. So just protecting it up to a point, not necessarily resting and doing nothing, but certainly not trying to overexert during that initial phase. The best exercise this initial phase is to try and get a little bit of movement through the back and potentially just a little bit of what we call a floss on the nerve, but you want to be really, really careful. You don't want to be irritating it. And the best thing you can do, initially is to just get that pain down. So a nerve floss, gentle back mobilization is going to be fine, just with the caveat of if you're causing any pain to really, really increase, then to just reduce it back down, give it some more time, and then try again. Once that pain has started to come down, then we can be thinking more about trying to stabilize the area. That is essentially what this is a type of instability in the back. So we've got the nerve pain down over time with treatment and with the right exercises. And now we're thinking, okay, how can we offer this area extra stability so that the body can actually just calm down the pain signals to the area and begin to just trust that it is all stable and is all resilient enough to cope. For that, I would start with just stabilizing exercises that don't actually require a huge amount of movement so that we can begin to just train those muscles, but we're not actually doing it under movement load. So that's just going to be a little bit safer. And then I begin to just start to load it during some gentle movement as well. And again, we're starting easy. We're not trying to sort of get you immediately into a deadlift position and push things forward. It's all about just sending the right messages to that area, getting those muscles switched on, and then just building it up slowly over time. So the really important trajectory there is that everything to help with the pain is originally, but not necessarily to try and stabilize. Then we're trying to stabilize without movement, and then we're trying to stabilize with movement. Hopefully that helps. If you're someone with a disc problem, you'll know they are really, really unfortunately painful, but this approach does work for a lot of our patients here. If you're in the South London, Surrey area, if you're struggling with chronic lower back pain or you've got an acute disc, anything that's going on, and you want to speak to us, there's always a link to our website where you can drop us a message on there. Just with your particular situation, if you want to sort of see if we're a good fit for you or something like that. Or you can book a completely free visit where you come in and talk to a practitioner, and then we'll definitely be able to tell you if we're likely to be able to help. If you find this stuff useful, guys, please subscribe. It's helpful for the channel.